Good evening, everyone, and welcome to Simon Fraser University Surrey campus. I'm first going to respectfully acknowledge that SFU is situated on the unceded and traditional territories of the Musqueam, Squamish, Tsleil-Waututh, Katzie, and Coquitlam nations and other Coast Salish peoples. So on behalf of SFU's Faculty of Health Sciences, I'd like to welcome you to the Surrey Firefighters Lecture Series. I'm Tanya Bubler. I'm the Dean of the Faculty of Health Sciences at SFU. And first, I'd like to acknowledge a special guest we have in the room tonight, Rich Bodnark, who's the chair of the Surrey Firefighters Charitable Society. We're very grateful to the Surrey Firefighters Charitable Society and Cheryl and Marina Haddad for their generosity and vision to create this lecture series to specifically address topics on mental health and addiction research. As Canada's engaged university, SFU is well known for community engagement, research impact, and knowledge mobilization activities. In particular, the students, faculty, and alumni of the Faculty of Health Sciences work towards healthier communities by addressing critical local, national, and global health problems, accounting for social justice and equity. Tonight's discussion on the legalization of cannabis in Canada and its implications on our community could not be more timely. Faculty from the FHS Centre for Applied Research in Mental Health and Addiction and the Canadian Drug Policy Coalition have put together this evening's panel to explore the many myths and misconceptions about non-medical use of cannabis. Before I introduce Donald MacPherson and Will Small to begin their moderation of tonight's panel, I'd like to invite Rich Bodnark to the podium to say a few words on behalf of the Surrey Firefighters Charitable Society. Thank you.
I'm going to use my cell phone just to do my notes, and then I'll turn it off, I promise. On behalf of the Surrey Firefighters Charitable Society, I want to thank everybody here this evening. I want to thank Clement for organizing this and also all the other organizers that have it a part. Who is the Surrey Charitable Society, Firefighters Charitable Society? We are made up of 415 members of the Surrey Fire Services. The 5 executive officers of Local 1271 sit as the board of directors. We are not professional fundraisers, nor are we professional advertisers. We are just a group of small individuals that recognize the need within our community, and we do our best to address it. We are 100% not-for-profit. Every dollar earned stays within the community of Surrey. When the partnership with SFU was put on the table, it was a no-brainer for us to step up. No pun intended either. We're proud to sponsor this lecture series in mental health and wellness. As first responders, we are the frontline workers that deal with such individuals that struggle each and every day with addiction issues. As we all know in this room, these issues are usually accompanied by mental health concerns. It is also very important to note that Surrey Fire Services members are caring and compassionate people, but we are not immune to these exposures. We know that through continuous education, strong resiliency programs, individuals can develop skills that allow us to move forward in a healthy capacity. At this time, I'd like to turn the podium over to Donald MacPherson and Will Small. Thank you very much, and we appreciate it.
Hi. That's like an award show, eh? It's like, who's got the award? I'm Donald MacPherson. I'm the director of the Canadian Drug Policy Coalition, and we're a partner project with SFU and the Centre for Applied Research and Mental Health and Addiction, and located at Harbour Centre in downtown Vancouver. And we work, much of what we do is to support informed public dialogue and discourse on issues of drug policy, including mental health and addictions and other kinds of drug policy issues.
Great. And my name is Will Small. I'm an associate professor in the Faculty of Health Sciences, research scientist at the BC Centre on Substance Use, and the director of the Centre for Applied Research in Mental Health and Addiction in the Faculty of Health Sciences, CARMA. Thanks to everybody for being here tonight, and thanks to our presenters for contributing their time and speaking this evening. And Donald and I will be moderating this session together, and we have quite a amount of time for questions and answers after the lecture lectures have concluded. So I think that we should dive right into it unless you had any other comments you want to make, Donald. So I'll let Donald introduce our first speaker.
Yeah, I'll just say a few words about how we curated the. I mean that we are at the beginning of a new age in terms of the way we deal with cannabis in Canada, and it's a discussion that's going around the world. Certainly in the Western developed world, there's a lot of discussion. Every month there seems to be another initiative in the U.S. Moving towards regulating adult use cannabis. So we have three speakers covering different. There are multiple aspects to this issue, as you can all imagine. We could have probably 12 speakers up here looking at all sorts of interesting issues, including the industry, the new emerging industry. So we have Scott Bernstein, who's going to give us a sort of general lay of the land and some of the history, and MJ Milloy will be giving us another angle on the whole cannabis use and how it relates to other substance use issues in BC, and then Stephanie Lake and will give you longer introduction. Stephanie Lake will talk about the youth and sort of education around the concerns about cannabis and sort of a reality-based, evidence-based education stuff. So, but Scott Bernstein is the Director of Policy at the Canadian Drug Policy Coalition, and he's been involved in drug policy for many years, a former lawyer with the Pivot Legal Society in Vancouver, project officer with the Open Society Foundation in New York, which is with the Global Drug Policy Program. So Scott has a global view as well as a view from the downtown east side with his work with Pivot, and now we're very much focused on Canada and the emerging issues with drug policy and including cannabis. So Scott.
Hi. I was just commenting to Donald on our trip in here. I wonder when alcohol prohibition ended and they created a regulated system. Did they have a lot of public discourse about how are we doing and what do we think about it and how do we educate? And his answer was like, no, probably not. And so I think actually I was actually really happy because we are talking a lot about it and we're reflecting a lot in different circles about what's happening with cannabis legalization. And so I'm going to present a couple things. One, as Don mentioned, a bit of the history, like how did we get to the point where we were prohibiting cannabis in the first place, and then what came out of it? What sort of structure do we have around legal regulation at this point? And so I want to spend a bit of time talking a bit about history. And so you can see from these diagrams up here, these are historical depictions of this plant, and the plant is Cannabis sativa. It's an ancient plant that comes from Central Asia and the Indian subcontinent, and so it has a written, documented use that goes back about 5,000 years. But beyond that, there's actually archaeological evidence that it was used much, much longer, and so we're not actually sure, but it could be up to 15 or 20,000 years that cannabis has been used traditionally. And so some of the reasons it was used are around the plant is the same plant as hemp fiber, and so we know hemp as rope, clothing, shoes, paper. Cannabis was also used in different ways as food and drink. The oil was used in some ways, and then also for ways that people are still using cannabis around spiritual practices, medical purposes, and then sometimes just for recreational use, or what we like to talk, in the field we'll call like non-medical or non-scientific use. So it's sort of everything else. And so it's a long history that goes back, and it's only very recently that we started to regulate and prohibit its use. And so The cannabis plant itself is interesting because it has hundreds of different chemical substances, including one of a certain kind of a compound called cannabinoids. And so there's about 100 or so cannabinoids in a cannabis plant. And those cannabinoids are the compounds that react with receptors inside of our brain that are called cannabinoid receptors, not surprisingly. And so tetrahydrocannabinol, THC, is probably the most common of these substances that we know about. And so that's the substance in the plant that gets people high and that feeling of euphoria when they consume it. And that's because of that, that's the most common one we know about. Another common one that we're starting to talk about now is cannabidiol, which is CBD. Sorry, I have a typo in there. It's not the CBC. That's the Canadian Broadcasting Corporation. CBD. But so that's that compound though is non-intoxicating, and it's known to mitigate some of the negative effects that happen with THC, and THC, CBD, and also some of the other chemicals are now being investigated for different therapeutic uses and things. And so this investigation is, I think MJ will talk about, is really starting to kick in now that we're thinking about the new system of regulation, and we now have access to these chemicals more freely. Cannabis was used medically in Canada in the 1800s and the early 1900s, and it was used or touted as a treatment for all kinds of things from migraines and ulcers to mental, physical exhaustion, depression, insomnia. And it wasn't as popular as opioid-based tinctures and remedies that were widely available, but it was a common ingredient in a lot of medicines and tonics that were sold. And you could see an example of those in the photo there of some of the preparations, little brown bottles and such. And these were often sold in catalogs without a prescription or sold in a drugstore or an apothecary. So you just walked in and got this. And so it was widely available, widely used. So things changed a bit, and following on some racist movements within Canada that were response to immigrant communities coming and the perception that they were taking jobs and displacing other people. In particular, these were Chinese and Japanese immigrants. The powers that be started to enact policies that would target particularly these groups. And so, and we could see in the early 1900s, they started ratcheting up those policies, particularly targeted at the drugs that these immigrant communities were using. And so the first of these was the Opium Act in 1908. And notably, it targeted just smoking of opium, which was a form of consumption of opium that was used particularly by the Chinese community, but it did not regulate as highly things like opium tinctures or other preparations of opium, which were used by non-immigrant communities. So there was really creating a disparate system that was specifically targeted at some populations. So this moved along. In 1911, they started adding other things. Cocaine, morphine were increased. They started realizing that if we increase the penalties, we can also increase police powers responsible for enforcing this. And again, profiling Chinese residents and opium dens. And then finally, the Opium and Narcotic Control Act of 1920 came in, and this actually created a system with specialized branches in the government focused on this, and they were focused on the prohibition and enforcement of that. And cannabis, or termed marijuana at the time, was added to this act in 1923. And so, Fast forward to today's system, we now have different legislation, the Controlled Drugs and Substances Act, which captures many substances in Canada that are deemed illegal. We have another system for delivering legal substances, alcohol, coffee, for example, and now legal, regulated, marketed for cannabis. And so, interestingly, in 1922, the number of drug convictions were only 1,800 or so, but notably 60% of these were for Chinese people. And so at the same time then, also rolling in the early 30s was sort of this Depression era propaganda around the harms of marijuana. And so there were two movies that came out that were produced in the United States and also seen in Canada. And they were, The Assassin of Youth. Marijuana is the assassin of youth. And then the other one we know about, Reefer Madness. And this really interesting, at the time, this really interesting story came out in the Globe and Mail, interesting historically, which the headline of it, so this was 1938, the headline was, "Marijuana Considered the Most Vicious Narcotic." And the quote is, "Marijuana, harmless-looking weed that grows in profusion in some Southwest states and is common in Canada, is considered by the U.S. Federal Bureau of Investigation to be 10 times more powerful than cocaine and the source of the most menacing narcotic problem facing the American continent." So there was a lot of this ramping up of prohibitionist forces that really led to policy ratcheting up as well in tandem. And so, time passes. I'm not going to take you through day to day how we got to where we are, but the situation got worse. There was a lot of criminalization and arresting of people consuming cannabis, but the tide actually began turning sort of around the 1970s, where there began this growing understanding that prohibitionist policies don't exactly align with the harms that people experienced and see with cannabis. And so the first of these that came out was really the Ledane Commission report, 1972, called for the repeal of prohibition on personal possession, so basically decriminalization, and ultimately an increased research into the effects of what would happen if we legally regulated. And there was actually a minority opinion on the commission that said we should just legally regulate cannabis at the time. However, that report was largely ignored by the government at the time, and so nothing really came out from that directly. And then in the 80s and the 90s, there was increasing civil disobedience around selling and using cannabis. For example, Mark Emery distributing and selling cannabis seeds, and opening up of different shops that were selling cannabis. 420 protest developed. And then also on the medical side, we saw things like the Compassion Club opening up, providing medical access to people with cancer or serious illness, for example. And then there were also this series of legal cases pushing for legal medical access. There was a promise by the Liberals and Justin Trudeau to legalize cannabis if they were elected, and they were. And once elected, they created this federal task force to scope out some of the issues with cannabis legalization and make recommendations. So out of that came the one of two pieces of legislation addressing cannabis. And so the main one is a new piece of legislation called the Cannabis Act. And that, I think we're familiar, that came into force last fall with the first introduction of cannabis for legal purchase in Canada. And so there are three aims to the government's decision to legalize cannabis. The first was keep it out of the hands of youth, and an understanding that the illegal market was actually allowing a lot of access to youth as it was. And so there were a lot of Canadians consuming cannabis even before legalization. The other point was to keep profits out of the hands of pockets of criminals, and ultimately to undermine the illegal market for selling cannabis. And then the third is general, let's protect public health and safety by allowing adults to access legal cannabis. And so the government federally set some specifics in their role. And so one is across Canada, a minimal age of legal access of 18. And you can possess and share up to 30 grams of legal dried cannabis, and then sort of the equivalent in oil and is possible. You can buy dried fresh cannabis, oil, or seeds from provincially licensed retailers or online. You can grow up to 4 plants, and then you're free to make your own food or drinks or whatever out of cannabis that you purchase. So there weren't restrictions on that. And then importantly, they said, well, so this is sort of the baseline. Provinces could enact more stringent restrictions within their own jurisdictions, and so they allowed, for example, the minimum age to be adjusted. And so edibles, so that we know edibles are just basically foods or drinks made with cannabis products. Those are going to be available roughly this fall, they say, a year after legalization took place. They're scoping out what that market would look like. There's high demand of people to have that as a form, people who don't want to smoke or otherwise. And then the other part of this is the federal government invested $46 million over 5 years for education. And so you probably have seen some of the signs that are up, and there's different things online about educating people about cannabis. So it's a joint jurisdiction between the federal government and the provincial government. So the federal government gets to regulate and license the producers and what they do. And so things like what kinds of things can they sell, what kind of labeling and packaging is required, serving sizes, potency, things like good production practices and safety is important, tracking requirements, and then also this restriction on promotional activities. So there was a lot of incentive to not create a commercialized cannabis market, much like we see if we go south of the border. If we look at Washington or other states that have legalized, they have a bit of a different approach to it, where it's commercialized and it's a bit more Wild Westy out there, I would say. But for us, the idea was to really keep it tightly in a public health framework. Provinces are given the other ends of the supply chain, so they can regulate how distribution is done, and they can also regulate how retail sales are done. And so they have some different choices around it, online sales, and so that's very helpful when people live in rural areas and want to access it and don't, necessarily there's not enough incentive to open a physical store. People can still, anywhere in BC, can purchase online, for example. And then there could be a choice between government-controlled retailers or private retailers, or some kind of mix between those two. So in British Columbia, the system we ended up with is the province designated the liquor distribution branch, which is responsible for supplying liquor to basically now think about and regulate cannabis distribution. We also have online sales at the BC Cannabis stores. Sorry, that text came out green. It's bccannabisstores.com. And then the government also decided there would be a mix of government-run and privately run retail sales. And so you can see sort of through that diagram that's on the provincial website, it's sort of showing you basically what I just described, that there's, federally, they deal with the first end of the supply chain. Provincially, we deal with sort of the middle pieces of it, the distribution and the retail sales, and then ultimately down to the customers who are it says they're, ID check, but there's actually more to it than that probably. So This is a misleading map. Each of those dots, and this is again on the government website. Each of these dots represents a licensed cannabis retailer in BC. And so, looking at this, you'd say like, oh, there's what is that? 7 of them in Vancouver. In reality, having a license does not mean you're in a position yet to open a store. And so, to date, we only have 3 legal stores where you could purchase legal cannabis in Vancouver. And so, this is, and then across the province, there's more licensing going on, but ultimately it's been a slow rollout of actual physical locations. So is there a place in Surrey? Let me know. There's not, yeah. Abbotsford, okay. It's a long way to drive. Yeah, do you want to ask that a little bit later, because I have an opinion, but just, yeah, I mean, I think we'll do like Q&A around that. I have some opinions on that, though. Okay, so here's what we get. You walk into a store. It's a very routine. So it's the top left image. You walk into the store. You basically can't touch cannabis. It's under glass and sealed packages that are government approved. It's sort of, I don't know if you can see, but it's sort of plain packaging if you haven't seen it before. The top right is an image, what you get when you go to the website. You could see a picture of some different dried flowers. And then in the bottom, I ran across this in I can't remember I think it's called the Garden Works down on Marine and the bottom. And they had this, grow your own cannabis kit, which doesn't include the seeds. And so this was I forgot the price, $160, which basically it doesn't even get you the soil. It gets you just the fertilizers, right? And so you have to buy the soil, and then you have to go and spend, it's about like $70 for 4 cannabis seeds in a licensed retailer. So it's a if you want to grow your own, but people who do this say like, it'll produce, look, over the long run, it's economical to actually grow this if you want to do it. Okay, so it's really important when we're reflecting on cannabis legalization to think about like, how do we measure the impacts and the effects of going through this policy change? And so the first thing that we should repeat as our mantra is it's too early to make many conclusions. Right? So we're only 8 months into a system that really overhauled 100 years of prohibition and created a new market. It's too early to tell. And so when you're reading news articles that are sort of, scaring you, like, oh my God, the youths are consuming more cannabis, or everybody's driving stoned, you really need to take that with a grain of salt to say, like, we don't yet have the tools in place to measure because it hasn't been long enough. And so some of the things we may want to know about, but it's still too early to tell, are like, has cannabis use increased or decreased? Has the patterns of people driving under the influence of cannabis and or alcohol changed because of legalization? Has it actually had an effect on criminal activity or the illegal market? And then, do we have the right system of pricing and supply and licensing in place? And recognizing like it's still working out the kinks of the system as it grows. And then also the other thing we'd want to know about are like, is the fact having legalized market changing the perceptions of Canadians towards legalizing cannabis or even thinking about legalizing other substances? But there are some concerns. So one of the big ones is, in my view, is that legalization missed an opportunity to address some of the historical and systemic harms that prohibition caused people, particularly communities of color and Indigenous populations in Canada, who were disproportionately targeted with arrest and the criminal law. And so we need to create a system that looks at expunging records. It needs to look at making a different kind of restitution by providing avenues in a legal industry for people and addressing this. And so that was something that, it hasn't yet been addressed by the government. And so we're continuing to advocate for that. Big cannabis corporations are doing well in this new market. It's not really, there really doesn't seem a place yet for craft cannabis, and there are now regulatory hurdles for craft cannabis producers to be involved in this. And so this is sort of allowing, like we do with beer, allowing microbreweries to have a chance to compete in this market rather than the big producers. There's still the system to measure whether people are impaired with cannabis while they're driving is not a replica of alcohol. With alcohol, you could take a breathalyzer test, and your blood alcohol concentration is directly proportionate to, it's a linear relationship to how inebriated you are and how affected you are. With cannabis, though, THC, the cannabinoid that makes you high, stays in your system for a long time after you've consumed it. So they could test your blood or your saliva. You could still have THC showing up there, but you may not be impaired. So these are going to be the legal challenges that are coming forward with people who are charged under this. Also, the environmental impact, it's a lot of plastic and a lot of packaging around cannabis right now that people complain about. There's still criminal risks to young people and also those acting outside the legal system. And so some of these penalties in place can be quite severe. So sharing cannabis with a person underage could have a penalty up to 14 years in prison. And so, that's quite severe for a 19-year-old sharing a joint with an 18-year-old friend, for example, which would be covered under that. Another big concern now is around the slow scale up. And so when we think about a public health approach to legalizing drugs, we have to think about not creating so tight and a risk-averse system that we fail to attract the customers that we need to bring into the system. And so if we really want to have people accessing legal cannabis and we really want to undermine the illegal market, we need to actually have a system in place that lowers the barriers to participation. And so this means, in a city like Vancouver, where there are 100 gray market illegal dispensaries operating, to have 3 dispensaries as an alternative to deal with that market demand is not going to be sufficient. And so, I think that's really, it has to be rolled up a bit faster, scaled up, and this is sort of a general concern across the country. And so, in a nutshell, it's the sky. The sky didn't fall. We legalized cannabis. This illustration basically shows we're chilling by the lake. It's no big deal. After legalization, we're still chilling by the lake. It's no big deal. There was a bit of a flurry immediately after legalization about media and stuff, but generally people go about their business. They're consuming cannabis like they did before, and it doesn't seem to be that the sky is falling. Okay, thank you.
Thanks, Scott.
Thanks. Sure.
Thanks for that. Very interesting, productive look at the history of policy and the current regulatory framework. So our next speaker is Dr. M.J. Malloy. It's my pleasure to introduce Dr. Malloy. He is an assistant professor in the Faculty of Medicine at the University of British Columbia, research scientist at the BC Centre on Substance Use, and is also the Canopy Growth Professor of Cannabis Science at the University of British Columbia. Thanks, MJ.
Thank you, Thank you, Dr. Small, for the introduction, and thank you to SFU for the invitation and the Surrey Firefighters Charitable Society for endowing this lecture. It's great to be sharing the panel with Scott and with Stephanie to give some of the perspectives on this new reality that we've launched ourselves into in the last number of months. I'm going to talk about sort of my own work, or the work that I'm leading at the BC Centre on Substance Use, looking at the ways in which cannabis legalization and cannabis use might interact with the overdose crisis. And of course here, Surrey, one of the epicenters of the overdose crisis in British Columbia and Canada, hopefully these words will be relevant. Before I get there, I want to share my disclosures so I can be transparent and you can understand who supports my work and my research. I receive money from the Canadian government, the BC government, and the United States National Institutes on Health. UBC has also received monies from two cannabis companies, as well as the British Columbia government's Ministry of Mental Health and Addictions to create the job that I currently hold as the Canopy Growth Professor of Cannabis Science. I don't have any personal financial relationships to the cannabis industry, and Canopy and the other funders have no control over the work that I do or the work that I present or the things that I say. I also want to respectfully acknowledge that I live and work on the territories of the Coast Salish peoples, including the Musqueam, Squamish, and Tsleil-Waututh peoples. As I mentioned, of course, we all know that we are living through the worst public health catastrophe of our age. And over the last number of years, we've lost thousands of our fellow citizens to drug overdose, which is a completely preventable and reversible cause of death. This catastrophe has many causes. There are many things which have contributed to us being in our current historic moment. One of the most important, though, and this figure published in Science last year, shows the startling increases in drug overdose deaths throughout the United States and Canada. And I think one of the things that should be apparent from the graph is the contribution of many drugs to this crisis, but primarily the contribution of synthetic opioids, most notably fentanyl. And that this has turned our illicit drug supply and the illicit drug supply into a contaminated and toxic drug supply, which has resulted in the deaths of many thousands of individuals. Here in British Columbia, of course, last year was the 4th year running that we saw unprecedented numbers of drug overdose deaths, not only in this community, but in my community, the Downtown East Side, and many communities across British Columbia. Despite the heroic efforts, not only, of course, of firefighters and other people on the front lines, but also members of the affected community, as well as clinicians and healthcare providers. There is, as I mentioned, a lot of causes that have got us to this point, including the failure to adequately regulate the very powerful opioid analgesics that many people receive through our healthcare system, the contamination of the drug supply with fentanyl, and unfortunately the continued reliance on really public security-based measures to try and control illicit drug use in our society. We also, unfortunately, don't do a very good job of caring for people who are living with substance use disorders, with chronic pain, with trauma. And for many people, when that combines, they are living with substance use disorders and are at the highest risk of overdose. And as well, we have seen really a failure to provide access to many of the evidence-based interventions that have been shown to protect the lives of people at risk of overdose, including methadone, naloxone, and supervised injection facilities. These are all things that we know. What I want to do in the time that we have is talk about the work that we are doing at the BC Centre on Substance Use to try and understand the role of cannabis in the lives of people at the highest risk of overdose, and to try and investigate whether or not cannabis might be part of a solution to the current overdose crisis. And this work really starts and really started and was really inspired by some work that's gone on in the United States by academics who have compared states with some form of legal access to cannabis to states that do not have any legal access to cannabis, either medical or non-medical. And the first article, the first study published in 2014 is the bar there on the far right. And what it showed was that states with some form of licit access to medical cannabis, states like Washington and Oregon and California and New York, have approximately 25% lower rates of opioid overdose deaths than states that do not have some form of legal access to cannabis. And in follow-up studies, researchers found that that also held true for other things. States with medical cannabis had lower numbers of opioid prescriptions. They had lower amounts of opioids dispensed into the community, and they had lower amounts of opioid-related hospitalizations. Now, because of the way the evidence works, we cannot conclude that there's a causal relationship here. We cannot conclude that it was cannabis that caused these differences. However, many of us have looked at these numbers and thought, well, is this because there are some people in these communities who have managed to substitute cannabis and use it instead of opioids for pain, for trauma, and the like? I should emphasize, of course, that cannabis, it's thought to be impossible to overdose on cannabis. We've not found a fatal dose of cannabis, and probably the continued existence of Willie Nelson and Snoop Dogg would, reassure us that that is not possible. So the idea here really is that by substituting cannabis for opioids, people are lowering their risk of overdose. So that's really the sort of the idea that we've been pursuing over the last number of years at the BC Centre on Substance Use. And the data that I showed in the last slide is very interesting and very evocative, but as an epidemiologist, I have to point out that the better evidence would be coming from drug users themselves, people at the highest risk of drug use, to try and find out why they use cannabis and what impacts those have on the risks of overdose. And so that's what we've been trying to do over the last number of years. At the BCCSU since 1996, we have been operating several large cohort studies of people who use drugs and are at very high risk of overdose. These studies include over 3,500 people, many of whom living in the downtown east side, although people have migrated to other places, including Surrey. And they fall into one of three studies. There are either, there is the VITUS study, which is HIV negative people who inject drugs. There is the ARISE study, which is HIV negative street-involved youth who either inject or use other forms of drugs. And then there is ACCESS, which is a study of HIV positive people who use illicit drugs. And these studies all work together, and they're very powerful ways for us to try and understand what the risks of drug use are and what we might do to try and ameliorate or mitigate these risks. In the past, we've used this data to support things like Insight, the safe injection site, and demonstrate its positive impact on people's lives, as well as other forms of interventions like needle exchange and HIV treatment for people who use drugs. As I said, these studies all work the same way, and the results that I'll show in a bit all derive from these three studies, which are, at the moment, some of the largest and longest running studies of people who use drugs in the world. Basically, what we do is we go out into the community. We invite people who are using drugs to participate in our studies. If they agree, once every 6 months, we interview them. We gather an awful lot of data on all sorts of their life, including their drug use, where they're living, what they do for money, their contact with the criminal justice system, their engagement in healthcare, basically anything we think which will impact their health and well-being. Over the years, we've recruited over 3,500 people, and we've gathered over 20,000 interviews. And we've also paired that with some biologic blood and urine and the like, other samples that we gather. In the last couple of years, we've turned our attention to cannabis to try and understand why people in this group are using cannabis and what impact it has on their health. The data that I'm showing there is from the last interview that we've done with individuals, and we ask people, why are you using cannabis? They tell us all the reasons, and then they tell us the most important reason that they use cannabis. And you can understand, or you can see in the results behind me, that recreation, intoxication, to get high, is the most commonly cited cause to use cannabis. Although there is also very substantial numbers of people in our studies who are using it for therapeutic reasons, to help their sleep, to address nausea, which might come from drug withdrawal, to deal with pain, and even to substitute for other substances. And although recreation or intoxication is the most important reason for many people, when you look at the numbers, over 75% of our people in our studies using cannabis report some sort of therapeutic intention. And when we began these interviews, as I said, we're very interested in the idea that people were using cannabis instead of something else. And we thought when we started asking people these questions, that they would tell us that they were using it instead of opioids. Both cannabis and opioids are pain relievers, and so the idea was that they were switching one for the other. So we were very surprised when we began to look at the data, to analyze the data, to see that in fact, the substance that people were most commonly substituting for was crack cocaine. Struck us as a surprise, and I'll never forget, I was at a dispensary presenting some of these results and said, well, we were all surprised. This is something that we didn't expect. And a customer at the front who was listening to my lecture said, oh yeah, that's what I do. I use cannabis because otherwise I'll just use a lot of powder cocaine. So by using cannabis, he said, he was able to control better his use of powder cocaine. And that was something that we heard from our participants. And when we further analyzed the data, and if you look at the blue bars there, this is data from people who are telling us that they were intentionally using cannabis instead of crack. You can see that there appears to be a decline in the frequency of crack cocaine use. And in our statistical models, we found the same thing. That after periods of intentional use of cannabis instead of crack, we observed in these participants a significant decline in the frequency of crack cocaine use among these people. Now, we cannot conclude that cannabis caused the reduced frequency of crack use. Indeed, it may be some other factor that we haven't measured. But I think the important thing for this study arising from this study is the knowledge that there are people in the downtown east side, people in our studies, who are using cannabis intentionally to protect their health. No nurse, no doctor would have said, hey, to try and control your crack use, why don't you try cannabis? This was something that sort of arose organically among the drug-using population. And interestingly, there are small studies from other places, especially in Central America, Central and South America, in which people down there are doing the same thing. So this is a very interesting finding to us, and it really spurred us to do more work on this idea that people were using cannabis intentionally to protect their health. These are some interviews. These are qualitative or ethnographic interviews done by the ethnographic team at the BCCSU, talking about drug use and how people control their drug use. And this was a very characteristic quote that one of the participants told us. She said, being on drugs for such a long time is like, that's how you're normal. And now when I stopped using, I'm still having a hard time adjusting. It's hard to deal with, and that's why I started smoking weed. And I share this testimony because it was very representative of what we were hearing from the participants, that many people would turn to cannabis as a way to try and deal with withdrawal. And in fact, there is data from scientific experiments, from animal experiments, showing that there is an interaction between the addiction, the systems involved in addiction, and the endocannabinoid system that deals with cannabis. And indeed, there is good evidence to suggest that for some people, cannabis might be a way to deal with drug withdrawal and to mitigate the negative factors associated with that, helping them to stay off of drug use. We've all heard of the gateway hypothesis, of course, and this next study that we did tried to test if what we were seeing in our studies was consistent with the gateway hypothesis. Grade 5, I was a very awkward elementary school student, rural Ontario, and remember the RCMP officer who came to our gym and told us, well, look, if you smoke weed, you're going to inevitably progress to using crack and using heroin. This is the gateway hypothesis, and it's been a real topic of a lot of controversy for many years. So we tried to test it in our studies, and what we did is we looked at people who had yet to begin injecting drugs. And of course, injecting drugs is a very important risk factor for overdose. It really increases your risk of overdose and other really negative harms, including HIV acquisition. So we were interested in maybe people who are using cannabis, maybe they are progressing more rapidly to injection. What indeed we found, in fact, though, was the reverse. This is data from the street youth cohort. About half of them have yet to start injecting when we first interviewed them. So we took the group of people who had yet to start injecting and we followed them over time. And we found that when they were using cannabis at least once a day, they were significantly less likely to initiate injection in that 6-month period. Again, we can't conclude that there's a causal relationship going on here. Maybe something else in these people's lives makes them less likely to inject and more likely to use cannabis at the same time. However, it is interesting that it is not consistent. It's inconsistent with the gateway hypothesis that cannabis use will lead to harder forms of drug use. Finally, we're very interested, and this is the last paper we recently published, we're very interested in the relationship between cannabis and methadone or opioid agonist therapy. Because of course, methadone and Suboxone are really the most important ways and the best ways we have of protecting people who are using drugs and lowering their risk of overdose. And so we were very concerned that maybe people using cannabis therapeutically or recreationally might be better engaged in healthcare. And then that would thus increase their risks of overdose. What we found, in fact, was the reverse. What we looked at are a group of people who were starting treatment for opioid use disorder. We followed them over time, and we found that those people who were using cannabis at least once a day were significantly more likely to still be engaged in methadone 6 months later. And this is a good thing because keeping people on methadone, keeping them away from the illicit opioids, the toxic supply of drugs, is an important way that we can protect their health and well-being. Again, we can't conclude that cannabis was the cause of this benefit, but we've heard from some participants that cannabis, for people on methadone, cannabis helps with unresolved pain, with other quality of life issues, and that's why it is helping them to stay on their medications. Finally, we looked at fentanyl exposure. And one of the realities of the overdose crisis is that many people don't know if indeed the drugs that they are using contain fentanyl. And so what we started to do a number of years ago was to elicit urine samples from individuals to try and understand who in our studies are being exposed to fentanyl most often. And interestingly, what we found, and this is sort of hearkening back to the earlier studies I showed, what we found is that if someone had THC, evidence of THC, so they'd used cannabis in the last month, if they had THC in their urine, they were far less likely to have fentanyl in their urine. We're not sure why that is. Perhaps, consistent with the idea of substitution, people are using cannabis instead of opioids, and they're less likely to get opioids. They're less likely to be exposed to fentanyl. But again, we're not sure what is explaining these results, but it is clearly a very strong relationship, negative relationship between cannabis and fentanyl exposure. Before I wrap up, I do want to ensure that I sort of share some of the limitations of this work, because really it is preliminary work. We're still learning from our participants about how they use cannabis, and we still have a lot more left to learn. As Scott mentioned, of course, there really is no such thing as cannabis. This new era has really led to an increased sophistication and increased knowledge around cannabis. Cannabis is a very varied number of substances with different types of chemicals in them, different routes of administration, and we have a lot to learn about how people who are using drugs use it in different ways. Our studies as well, they're not randomly recruited. And so it's difficult to conclude that the people we have in our studies are representative of the broader population of people who use drugs in the downtown east side and in the lower mainland. It is possible that sometimes when people tell us about their drug use, they're either misremembering or they are trying not to tell us about some of the things that they're doing because they're embarrassed or feel that it is shameful. However, we have been working with this population for many years, and I think we have relatively good relationships of trust and confidentiality with them. And as I said, there are still things that we've left to learn, not only in terms of the specific cannabis use strategies people are employing, but what some of the harms and risks of this strategy might be for folks who are using other drugs. Very few people who use cannabis exhibit any sort of disorder, cannabis use disorder or addiction syndrome. However, that of course is a possibility, that people would become dependent on cannabis. And at the end of the day, of course, I want to emphasize that this is preliminary and we can't conclude that there's some sort of causal relationship here. But in the end, I think we are sort of confident to conclude a couple of things. First of all, for people at the highest risk of overdose, cannabis is common. In our studies, more than half the individuals who are at highest risk of overdose are using cannabis at least once every 6 months, and most of those individuals are smoking cannabis every day. So it's obviously a very important part, or it's always a very significant part of their health and well-being. We have shown some preliminary results consistent with preliminary results in the United States and from other places, suggesting that people who are using cannabis frequently, who are at risk of overdose, might be deriving some benefits from this cannabis use. But it's still early days. And what we are doing now at the BC Centre on Substance Use is planning on and implementing clinical trials so that we can try and take the preliminary evidence that we've learned so far and see if we can replicate those benefits among people at the highest risks of overdose. Hopefully what we'll find are positive results, and hopefully we'll find new knowledge to help people who are at the highest risk of overdose and put new tools in the hands of all of us who are trying to address this terrible public health crisis. Thank you.
Thank you very much, MJ, for that presentation summarizing the research findings from your research program and the various studies there. Next up, our next speaker is Stephanie Lake. Stephanie is a research associate at the BC Centre on Substance Use and a PhD candidate in the School of Population and Public Health at the University of British Columbia. Thanks.
All right. Hi, everyone. So thank you very much to SFU for organizing this event and to the Surrey Firefighters Charitable Society for endowing this lecture series. So this is a bit of a treat for me because I usually talk more about my own research and my PhD. MJ is actually my supervisor, so I'm working on a lot of the same studies that MJ has just presented and some ongoing work that we're doing now. But today I'm going to talk a little bit about a project I've been doing on the side with the Canadian Students for Sensible Drug Policy. And that project is around cannabis education. So before I get started, I do want to acknowledge a few things. First of all, the Cannabis Education Toolkit that I'm going to talk about was really a team effort, was co-authored by a group of women, young women from across Canada, including Dr. Jenna Valeriani, Nazli Magzoudi, Marlena Goyendang, myself, Michelle St. Pierre, Jill Robinson, and Desi Pavlova. We received funding to do this work from Canopy Growth Corporation, which is, of course, a licensed producer of cannabis, although this was an arm's length grant, and so the funders really had no say in the design or any of the research that was involved in the toolkit. We also had all of the material reviewed by an external committee of experts, as well as a youth content team. So the Canadian Students for Sensible Drug Policy is a grassroots network of students and youth across Canada who are concerned about the negative impact that our drug policies have on our communities. And so we really advocate for drug policy reform that's really rooted in the principles of public health and human rights. We have chapters across Canada, so I'm involved with the UBC chapter. We don't have a chapter at SFU, so if anyone is an SFU student and interested, please come talk to me. So young people in Canada really lead the developed world in rates of cannabis use. So you can see here that by the time students reach grade 12, over 40% have tried cannabis at least once in their lifetime. About 1 in 3 have used in the past month. And about 1 in 5 have used, about 1 in 3 have used in the past year, and about 1 in 5 have used in the past month. And among a small percentage of individuals, their patterns of use do progress to kind of a point that would be considered problematic or at risk of being problematic. And so this is, of course, a concern. And of course, when, as Scott mentioned, when the Prime Minister did kind of introduce cannabis legalization into the party platform for the Liberal Party, protecting youth was really a key driver in introducing this policy. And so leading up to legalization, CSSDP organized a roundtable with young people in Toronto to try and elicit some feedback from young people about kind of the impending legalization so that we could submit a report to the task force that really brought forward the voices of young people, because we know young people are using cannabis. And so we were really hopeful that this would not be overlooked. But interestingly, something that really came out of this roundtable was the need for better cannabis education for young people. So as it stands, kind of before legalization, cannabis education was always kind of wrapped up into just overall drug education. So as I'm sure you're familiar with some of these education campaigns behind me. So for example, the Drug Awareness Resistance Education, which is a kind of a police-led initiative. Then we've got the This Is Your Brain on Drugs campaign. A lot of these educational campaigns are really rooted in abstinence. So they kind of have this message that abstinence is the only positive or the only kind of outcome that would be considered good. Any other cannabis use is considered problematic, and there's really no room for any discussion in between. But unfortunately, this messaging doesn't tend to resonate with a lot of youth because, as I just showed you, about 40% of kind of grade 12 students have used cannabis at least once. And so they are completely left out of this messaging. Something else that came up in the conversations with youth was that a lot of these campaigns are very stigmatizing. So if you've used cannabis before and you're being called a pothead, or you're kind of just seeing this general messaging that cannabis use is morally wrong, then you feel extremely stigmatized and you're not going to want to talk openly about your cannabis use. So of course, this is going to impede your ability to get good education around cannabis. So with this in mind, this is kind of how we came to develop the Cannabis Education Toolkit. And I brought a few here. So if anyone's interested, you can come and get a hard copy, but you can also download it from our website for free if you don't want a hard copy. So the Cannabis Education Toolkit really has two parts. The first part is a set of guiding principles that's based on research. So what are the best practices for delivering an effective cannabis education? And so just briefly, the 10 guiding principles, I won't have time to go over all of them in depth, but they are first and foremost, delivering education that's grounded in evidence. Second, having and supporting open, non-judgmental, and interactive approaches to cannabis education. So not just kind of like a person in a position of authority having a one-way exchange with students or young people. Meaningful inclusion of young people in the design and implementation of the education. Delivery by a trained facilitator or a peer. Starting earlier in kind of earlier on in development with age-appropriate content and kind of integrating it throughout education all throughout high school. Supporting parents to have age-appropriate conversations about cannabis with their kids. Including harm reduction in the approach. Tailoring the education to different contexts and particularly different kind of populations that you're teaching. Having education be ongoing, so continuous throughout education instead of just kind of one brief discussion at one point. Like, for example, I remember in high school I had maybe one or two assemblies where we learned that was our kind of drug education. So it would be more like integrating it throughout the curriculum. And then finally, attention to the overlapping issues of racism, social justice, and stigma, as kind of Scott was alluding to earlier. And then second of all, we have this pull-away curriculum, which really kind of helps parents or educators try to kind of tailor their curriculum of cannabis education. So briefly, just going over a few of the guiding principles. So education grounded in evidence. This is a top priority for us because so much of the education that came before legalization was really rooted in stigma and abstinence and did not provide really a balanced approach to the state of the science around cannabis use. And so what happens with these types of approaches is that young people hear that cannabis is really bad, it's going to cause all of these issues. They try it, and that doesn't happen. And so trust is broken between young people and educators or young people and people in positions of authority who are telling them these messages. And so the education really needs to go beyond just saying the simple message that drug use is bad, and instead presenting youth with a really balanced perspective on the potential risks to their health, the reasons why people might use, et cetera. Second, supporting open, non-judgmental, and interactive approaches to education. So young people really don't have a lot of opportunities to engage in conversations about cannabis, especially with people in positions of authority. And so it's important to really support these open conversations between young people and the deliverer of the education, as well as just young people between each other. And so there's different ways that this can be done. So the toolkit details a little bit more, but for example, showing a film of kind of the depiction of drug use in one way or another and having a discussion about how that drug use is depicted and is it realistic, et cetera. It's a good way to get young people talking about cannabis in a way that isn't just, one person giving information. Meaningful inclusion of young people. So I think this is pretty obvious, but of course, when we don't consult with young people about their experiences, we tend to miss the mark. And so this can easily happen with the language we use around cannabis use. It's really important to be able to actually ask people about their experiences so we can integrate that into the education in a way that really resonates with them. And of course, we should be doing this in a way that's not tokenizing. We don't want to just have a young person at the table just to say we did it and then not really value or listen to what they have to say. So inclusion of harm reduction is extremely important for the toolkit because we really do, in our education toolkit, this is really a toolkit that we made with the intention of reaching young people who are already using cannabis. And so harm reduction is key for this population. The research really shows that harm reduction messaging is most effective with older students as well as students who are already using cannabis. Importantly, teaching harm reduction strategies does not encourage young people to use cannabis. It is simply helping individuals who are using cannabis think about the ways that they might be able to reduce some of the harms that are associated with using cannabis. And so these interventions can really be introduced in a variety of settings, including in the classroom, but as well as medical settings. So if you have a young person, if you are a medical professional, you have a young person coming in for a reason that might be related to cannabis use, that's a really great time to kind of start the harm reduction messaging. So here's the main harm reduction tips that we have included in the toolkit. So first of all, start low and go slow. So definitely test out a product first before just going all in. Understand how it might affect you. Consider appropriate time and place. So being in maybe an unfamiliar setting or with people who are new to you, that might elicit a different reaction to cannabis that you might have with friends that you're really comfortable around. And so that's something that people might want to consider. Choose, there's a little typo there, but choose less risky products. So this would include things like lower THC products. Choose safer modes of administration. So for example, vaping is a safer mode of administration than smoking. Edibles are safer in terms of than smoking in terms of not being exposed to smoke, but of course something else to consider is that edibles have less predictable effects, and the effects tend to be stronger and last longer. So it's something to consider in terms of time and place. Reduce the amount, or if smoking, we also have safer smoking practices in the toolkit. Reduce the amount and frequency of cannabis use. So we tend to tell people things like, if you're going to use cannabis, try to limit your use to maybe just on a Saturday or a special occasion in a way that's not stigmatizing. Avoid synthetic cannabinoids altogether, as these products can cause really severe adverse health outcomes. Avoid using cannabis while using other substances, particularly tobacco and alcohol. And then, of course, if you're traveling, arrange a safer mode of transportation. Young people do tend to think that it is okay and safe to drive high, but the research actually does show us that there is an increased risk of impairment, and this does affect driving ability. So it is definitely not safe to drive high. Finally, I'm going to focus just a bit on this attention to overlapping issues of racism, social justice, and stigma. And so this is really something new that we've presented in the toolkit. We haven't really come across a lot of evidence for if this works or not, but we think it's important to test out. as Scott alluded to earlier, Canada does have a really kind of racist history of our drug laws, and those health inequalities are still happening today, where especially in the Black communities and Indigenous communities, individuals in these communities are disproportionately targeted for their drug use, including cannabis use. And so it's important to acknowledge these issues, especially if we're working with vulnerable populations. Okay, so the pull-away curriculum has 4 parts. Harm reduction is one of them, and I already focused on that, but I'll go over the other 3. So first of all, we have just kind of a Cannabis 101 section. It really helps. I'm sure a lot of young people probably don't need this education, but parents and educators might. So it actually just outlines what cannabis is. It outlines what the different cannabinoids, or the 2 kind of main cannabinoids of CBD and THC, what they do, what their effects are. And then it also highlights kind of a number of different ways, different types of products, and then ways that cannabis is consumed and how this affects the adverse kind of feeling that it'll induce. We also have a section on reasons why individuals or youth might choose to use or might choose not to use. And so this just helps the educator kind of modify or tailor the education for that specific audience or that specific community. We also have a historical and legislative background on cannabis laws in Canada, just to try and situate the situation a little bit more. So we focus a little bit on the key elements of the Cannabis Act, particularly the parts that kind of deal with young people. And then we also have a little section talking about the medical cannabis program, the unregulated dispensaries, and kind of differentiating between all this, because there is a lot of confusion around that. And then finally, this is the part I worked on in the toolkit. We have our kind of a quite a concise, but I would say very comprehensive summary of the evidence around the short and long-term health impacts of cannabis use. And so in this section, we really go over a lot of different health outcomes, and we state what the current state of the evidence is around it. So we, first of all, try to support young people and educators to understand the difference between correlation and causation in scientific research. So this can help them be able to critically analyze research that comes out on cannabis. We talk about the risk of cannabis abuse and dependence. Cannabis use disorder is called now. We talk about the different state of the science on impacts on the developing brain and cognition, which is a very important one for youth and something I think a lot of people are quite concerned about. We talk about the relationship between mental health and cannabis use. We talk about the acute possible adverse effects of cannabis use. We talk about the state of the evidence on possible long-term physical health effects. So this includes things like lung cancer, stroke, other respiratory issues, et cetera. And finally, we have an evidence review on the gateway theory that MJ was just talking about. So we talk about why this theory exists, what might be underlying this theory that so many people think that using cannabis leads to harder drug use. So we try to kind of demystify that a little bit. Okay, so just kind of some key takeaways from this project altogether is that the legal regulation of cannabis offers an opportunity for us to have more pragmatic conversations about cannabis use with youth, instead of just saying it's bad, don't use it. Access to evidence-based drug education is really critical for young people to develop their health literacy, and it's of course important for their well-being. Young people in Canada are diverse, and there's no silver bullet approach, and so we don't try and say this is the only approach that you should use to teach young people about cannabis, but it's more just looking at what might be some of the best practices that we have, that we know based on the state of the research. Approaches that meaningfully include young people should be prioritized, as we do want this education to really resonate with them in order to be effective. And finally, drug education and cannabis conversations should be inclusive of both prevention and harm reduction. It shouldn't be one or the other. I think it's important that we reach young people who haven't started yet, but of course there is that 40% of young people who have at least tried it once. We do want to reach them. We don't want to alienate them. Thank you very much.
Thank you very much, Stephanie, for the great presentation about the Canadian Students for Sensible Drug Policy recommendations on cannabis education. We're on to the question and answers portion of the program. So I'll invite the presenters to join us up here at the front and perhaps ask Donald to come up to the front here again, if you would. So we would welcome questions from the audience. We have microphones, and if you do have a question, please raise your hand, and then we'll get a microphone to circulate to you so that everybody can hear the questions, and we can try and include those on the audio recording as well. And Donald will moderate this, and we'll try and keep track of where the questions are coming from and try and give everybody a chance to voice their questions. And there was a question that had come up about enforcement and illegal cannabis shops that had arisen in Scott's presentation, and I'd missed who'd asked the question. Maybe we could just start off with that. Thanks.
If you don't speak into the mic, it doesn't end up on the audio, I guess.
Hi there. No, I was just wondering what the government's doing about illegal cannabis shops.
Yeah, so I think, again, so the enforcement of the law comes down to provincial and in some cases municipal law enforcement policy decisions. And so I can speak to Vancouver and the VPD, which, in 2014 or so, I think it was, there was this proliferation of these quote unquote medical cannabis dispensaries, and they adopted a non-enforcement policy, and ultimately the city decided that they wanted to use sort of zoning and licensing to regulate like where these buildings were. They couldn't control the product that was inside of it because that was a food or drug act kind of jurisdiction, but they could control like where these businesses were located. So there, many of the illegal dispensaries went down that path of spending a lot of money and applying for a license and going. And so now post legalization, there's a couple of options that they could take. One is like, okay, we have some legal access. Let's shut down the illegal stores. But still, we're in this position now where there's a bit of wait and see and non-enforcement of it. And so what's happening, what we're experiencing is a lot of these dispensaries have sort of made the decision themselves, or it's been, told to them. It's like, okay, we sort of let it slide up to now. October 17th, 2018, though, you really have no excuse. So if you want to participate in the legal market someday, we'll be looking at your track record from now forward. And so a lot of them have shut down and are pursuing getting licensed provincially. Other ones, which I assume they're continuing to operate, and I'm assuming they'll, try to keep going until they're pushed out either economically or through law enforcement. So I think it's just sort of it's an approach now that I think recognizes the fact that if there was a strong response from police to shut down all of these dispensaries, what we are left with is not steering everybody to the legal market, rather steering them back underground to the illegal market, because there's still a lot of people out there who would sell cannabis outside of the legal market. And I think it's just sort of a rationale like, well, at least I know it's taking place in this store, and it's going to happen. And I think there's a general understanding that that's not going to last forever. Like at some point, there's some threshold where there will be enough legal cannabis stores to deal with all those people who are participating in it, and those other businesses will either close down for economic reasons, or at that point we may see law enforcement. In other provinces, there's been a more aggressive approach on some of these illegal dispensaries, but that's sort of also been the history from day one since they popped up.
Thanks. I think MJ just maybe was going to add
The only thing I'll add to that, which I think is a perfectly fine summary, is that we're learning through our research that access to the legal market is not only a case of, is there a legal retail store close to you? There are 3 to 5 in Vancouver, I think, right now. We're learning in our studies that only a very small number of people in our studies, so downtown east side folks, people who are generally poor, are in fact accessing cannabis through the legal market. And when you go to a legal store, you quickly figure out why. The median price for cannabis in the downtown east side, bought from a dealer or some other illicit source, is approximately $6 a gram, and you can buy smaller amounts than that if your dealer will sell it to you. The minimum price at a retail store in the legal market is sort of $14 to $16 a gram, and you have to buy a gram at a time. So so that's another sort of access issue, which I think will be continually problematic for folks at the lower end of the socioeconomic ladder. They simply can't afford to buy legal cannabis.
Thanks, MJ. Okay, we'll go in the middle there, and then it looked like there was somebody at the back too. Thanks.
Actually, the questions that I had are kind of direct correlations to what you guys just talked about, and that is that two of the state things I wanted to have brought up was you were talking about the cost, and are they going to be trying to regulate that a little bit more? Because that was always my concern, is that if they continue to charge these exorbitant amounts of prices, you're not eliminating the black market. And then also with communities, that there are a number of communities that have publicly stated they will not allow them in their community. Is there a direct correlation to black market being more heavily used in those areas?
Yeah, I don't think there's any. Those are great questions. And I don't think we know enough about the illicit market to know sort of at that fine a grain. I do agree that it's plausible that if you lack a store in your community, you'll be much less likely to seek out legal cannabis. We have heard anecdotally people are reticent to use the online store because of concerns around privacy and whether or not their credit card number will pop up in U.S. Homeland Security. So that, I think, is another issue. And there was the first part of the question was. Pricing. What we've seen in other markets, especially Oregon, that have legalized, that in the first sort of couple of years, there's a sort of a supply crunch, and that's certainly what we've seen in Canada. There's been much more demand than the producers can satisfy. And in these places, what we saw a couple of years after legalization was a glut of product on the market. And Oregon especially saw people basically giving away cannabis because there was so much supply. I don't think we'll see the same sort of boom and bust here, but I would expect that after the supply issues get worked out, we will see declines in price, but I don't think it will ever approach the illicit market price.
Yeah, and again, the issue I didn't raise when I was talking about jurisdiction of like decision making is sort of the local level, which you alluded to, which was the fact that local communities or municipalities can decide, whether there are actual physical dispensaries in place or not. And so one of the issues that's come up in Vancouver have sort of been zones where cannabis dispensaries have been banned, including in the downtown east side, and so that's it's an issue, especially when you're looking at the research MJ is talking about. Like, well, this is a community that actually would really benefit from having legal access to cannabis, and why shouldn't we be promoting cannabis use in place of more harmful substances and provide that opportunities? And so I think that as well as these like pricing issues have to be worked worked out. And the goal with pricing, I think, like MJ said, it's really going to be hard to undercut the illegal market, but we also have to recognize, like, not everybody's going to just buy on price. Like, some of it's going to be people choosing to buy around the fact that they know what the quality is, or they know the store, or they want to purchase legally and not illegally. And so the sweet spot is sort of finding a price that's, high enough to discourage, excessive levels of consumption, and to make it profitable, but low enough to, entice those people away from the illegal market that are going to go. And in the reality, like, cannabis is so prevalent. It's so easy to grow. It's everywhere here. The chances are we're probably never going to eliminate completely the illegal market. And, maybe that's okay. Like, maybe if we capture, 60, 70% of it, we're happy. And it's a policy success.
I just wanted to ask Stephanie, have you done any work with the youth on where they are going to buy cannabis, given the issues of price point and availability?
I haven't done any research with young people asking them where they've gotten cannabis, but we did, as part of our evidence review for the toolkit, we did look into how youth were currently accessing under prohibition. And this included a variety of ways, mostly getting from, friends. So someone will have a joint that they got from somewhere and they'll bring it out at a party. And that's kind of how people are introduced to it. So some people do have dealers, other people it's more like my brother or my brother's friend. Like, it's just through the networks a little bit. Under regulation, I have not seen any research yet to show where youth are accessing, if they're accessing legal product or not. So that remains to be seen. I don't think that research has been done.
There was a question in the row just behind Richard there. Yeah, thanks.
Hi. So we were talking about the price of cannabis and those populations that have trouble purchasing the cannabis. So I was wondering if in Vancouver, if there are any collectives, like grow collectives or grow co-ops, in the same sense that we have bicycle collectives or bicycle co-ops that that provide services to the public to help them repair bikes. But in the same way, doing that for growing cannabis and supplying these populations that cannot purchase legal cannabis. Is there anything like that in Vancouver? Any like grow collectives or grow co-ops or anything of that nature?
So the closest you get are sort of three organizations that are all independent, but attempt to provide cannabis either generally at no cost to individuals that can't afford it. There's the BC Compassion Club, which began in the 1990s, and they sell cannabis, but it's at a price that people can afford. And then there are two organizations in the downtown east side, which started recently, which are giving out cannabis for free to people at risk of overdose. There's a group called the High Hopes Foundation, which is doing that. And then there's a group called the Cannabis Substitution Project. And both of these rely on donations from illicit producers. Licensed producers are forbidden to engage in that kind of activity. And unfortunately, the way Scott can correct me when I get this wrong, but the way the regulations work right now, it would be difficult, I think, to legally do what you're suggesting in terms of bringing people together and sort of cooperatively grow and distribute cannabis. Yeah.
Yeah, no, you got it right. Okay. And so it's actually something that's allowed under the medical cannabis regime in Canada, but not under the non-medical regime. And so it's very interesting. I'd suggest people have a look at cannabis social clubs, which are prevalent in Catalonia and Spain. And so this is a legal loophole that they used, which allowed them to create basically these collectives incentives like you're describing, where people would become members, and you don't actually like the collective doesn't own the cannabis, you do, but they grow it for you, and then they give you back your product that they've grown for you. And so that's one model that's not really allowed in our legal system, but it's actually working really well in Spain, and it's probably something that it would be great to have. What's that?
Uruguay.
In Uruguay as well, with legal cannabis.
There's a few questions at the very back there. I'd like to welcome those. Thanks.
Question for Stephanie. In terms of working with adolescents and also elementary students, are there any resources or approaches to even working with younger children?
Yeah, there are a few. So there is the Canadian Centre for Substance Use and Addiction. I think that's the right CCSA. They just came out with like a little pamphlet that was designed by young people, and it is really for like a bit of a younger audience. I wouldn't say it's quite elementary, but it's definitely younger than like grade 12, which is kind of our toolkit is maybe a little bit more focused on an older high school student. So there are definitely some more resources coming out. It's interesting, for 2 years in a row now, I've been to Ottawa to meet with Health Canada. A bunch of kind of different organizations have met with Health Canada to talk about cannabis education and all of our kind of various strategies. So I met with them 1 year in 2017, before cannabis was legalized, and there was almost nothing. And then 1 year later, exactly 1 year later, we all came back, and like the tables were just full of resources. So there probably is a resource out there for a younger audience. So if you do want to come and chat with me after, I can probably give you some kind of better resources. And at the end of our toolkit, we also have kind of links to other resources that we think are good as well. Yeah.
What's the right age to start talking to your kids about cannabis?
So we kind of, in our evidence review, we saw that it is actually better to start integrating education quite early, but this doesn't necessarily mean it has to be so blatantly cannabis education. It's more like skill building and social emotional learning, and just kind of trying to get critical thinking skills going at an early age, so that once the conversation about drugs is kind of, you're at the right age to talk about that, you can really kind of come at it with that good kind of health literacy. So a colleague in Calgary, Dr. Rebecca Haynes-Saw, who really does a lot of her work around youth and cannabis, she says this a lot, is like the best kind of education around cannabis actually doesn't deal with cannabis at all. It deals with other skills that really do help to support good literacy and good kind of decision making when it does come to drug education. So with that being said, I think kind of, especially in the new era of legalization, people and young people are going to hear about it, I think, a little bit earlier, because it's everywhere, it's in the news. And so I think it would be appropriate to have those conversations with young people about cannabis, just about what it is and what the laws are around it, that kind of thing, earlier on, probably towards the end of elementary school. And then we kind of see this good integrated cannabis education happening more in high school.
Thanks.
Thank you, Donald, Will, and Simon Fraser University for hosting this, and thank you, MJ, Scott, and Stephanie, for your nice presentations. I had a quick question for Stephanie. In the harm reduction slide, under point 7, you mentioned synthetic cannabinoids.
Mm-hmm.
I was just wondering, could you elaborate on how different synthetic cannabinoids could be compared to the national ones, and if there's any difference?
Yeah, so a synthetic cannabinoid is, you may have heard the term like spice or K2. It's generally referred to as kind of one of those two terms often. It's not used in high rates here in Canada, but it is, we do get some reports that it is used. So we included it in there because it's not a natural, it doesn't come from the plant. It's not a natural cannabis. It's actually a chemical that's been synthesized to try and interact with the endocannabinoid system in the body. And so it doesn't actually have the same effects as THC. But
In some places, it's available to buy a lot more easily than cannabis. For example, we see a lot of use of spice and K2 in the UK. And it does tend to have kind of unpredictable health effects. So we have heard reports of people having seizures and things like that. So we just are telling people to avoid that altogether because the natural product would have more predictable health outcomes, ones that we've studied for a much longer period of time. I don't know if anyone wants to add to that.
Sorry, but I had one more question on a similar note. So what about the cannabinoids that are made which have a similar structure and refractive index, basically the same isomer as the natural ones? Do you differentiate that in your education books?
Are you referring to more like pharmaceutical cannabinoids?
Yes.
Oh, okay.
Not durabinol. So maybe say, for example, biosynthesized cannabinoids, which use the genetics from the plant, put it into bacteria, and when you replicate, you get cannabinoids.
I see. No, we don't talk about that in the toolkit. We're very specific about like spice and K2. Those are what we're referring to.
Okay, because I mean, it would be almost incorrect to tell people to not take medicines, given the fact that these are technically the same structures and could be used medicinally. So I was just wondering, is there a distinction of what is synthetic cannabinoids, K2 versus synthesized for medicinal purposes?
Yes, I think I think, in my opinion, it is clear in the toolkit that that's what we're referring to. Yeah, but your point is very well taken. Thanks.
First of all, thank you so much for coming here today. It's been an honor to be able to attend this. My name is Yasmin. I'm in my final semester currently in the Faculty of Health Sciences at SFU. Last year, I had the opportunity to study abroad at UC Berkeley, followed by an internship in San Francisco. So I was in the Bay Area in California for just over 8 months last year. And what I thought was really interesting was cannabis was so easily accessible, and every single youth I interacted with or lived with or knew was using, and almost all daily. And so it was really new to me at the time. It was something I didn't have a lot of experience with, and I was a little bit I think I stigmatized it a little bit because what I was taught when I was younger is that it wasn't good to use, especially not daily. And what a lot of the youth told me was that, well, we use this instead of sleeping pills or anxiety medication or depression medication, and it comes with a lot less side effects. Now, most of the youth I know were self-medicating, so they weren't going through a physician to get this. And then coming back to Canada end of December after it had become legalized in Canada, I was still surprised to see it was a lot less accessible than it was in California. Now, California legalized the way it has about a year before Canada did. And I was wondering if you guys think eventually Canada would be the way California is currently, where it's so accessible and much cheaper, and there was like a shop on every block basically, and everyone was using all the time. So do you think it would move in that direction, or are we headed in a different, more regulated, possibly, direction?
I'll start. So as a public health researcher, and really seeing that the approach that Canada is taking is meant to be kind of more of a public health approach, they do, their kind of philosophy, I think, was to start really strict and then being able to loosen as time goes on, if it permits. So I think that is a good approach, because what happened in places like California is it was basically just kind of overly commercialized right from the beginning. And once that happens, it's really hard to rein it in. So I don't see it getting to that point where it's overly commercialized, overly marketed. You kind of see advertisements for it and stuff like that. I think in Bill C-45, there are a lot of restrictions on that kind of stuff. And I don't see the government really loosening some of that stuff, despite what the industry might kind of be lobbying for.
Yeah, I agree with Stephanie. Having been sort of south of the border recently and going to some of those shops in California that you mentioned, they're sort of like Cheech and Chong produced an Apple store, and it's quite shocking, having been in Canada, to see the sort of the diversity of product. I don't think we'll get there anytime soon, because as Stephanie mentioned, the industry here is much more regulated than in the United States. Right now, the only legal products are flour, seeds, and oils. We will be getting edibles and concentrates, which are the lion's share of the market in California and other legalized places. But there'll be restrictions that don't exist in the United States. And maybe most importantly, the Canadian government has placed very severe restrictions on marketing of cannabis. There was, they can't, for example, sponsor social events, concerts, or many of the things that other substance industries can in Canada. And I think that we will see over time changes in these regulations, but I don't think we'll get to the point of the United States where it's basically a free-for-all.
Thanks. I think we had a question down front. Okay. I was just going to offer one comment in relation to these questions. There was a point about daily use and young people with patterns of use, and we've talked quite a bit about young people's patterns of use. What I was going to mention is some scientists have developed guidelines for safer cannabis consumption, and one of the researchers that was involved in that was our colleague Benedict Fisher. They were previously published in the Canadian Journal of Public Health, and they've been revised recently based on some more recent science. And for young people, they have two main points of advice: avoid early onset of cannabis use, so that would be prior to 18 or 19 years of age, and avoid heavy patterns of use, particularly daily use. So there is some of that resonates with your sense of what may be problematic. Any other questions from the audience? Yeah, there it is. Yeah, thanks for your patience.
Hey there. I'm just wondering what Crown Council and the RCMP's mandate is, because it seems like a mismatch of rules depending on jurisdiction.
Maybe throw that to Scott.
I think the lawyer should take over that time.
Yeah. A mismatch of rules based on jurisdiction. Yeah. Well, I think that's more a characteristic of criminal justice in Canada than specifically cannabis. I think if you are standing in Vancouver, activities that are legal and allowed and tolerated, or I wouldn't say like legal, like say sort of the activities that are tolerated in Vancouver are going to be much different than when you move up to Prince George or something. Like it's just a different culture, but it also reflects to attitudes about prioritizing and what individual particular jurisdictions think is their mandate. And so, we've seen that rolled out. The negative side of this is sort of the disproportionate effect of criminalization generally around Indigenous populations or populations of color. And so I think, in a perfect world, we'd want to see like, okay, great, the law comes from on high with the federal government and it's uniformly applied across the country, so you know exactly what your risk is and what's going to happen to you. But that's not the case. And so I think ultimately what has to happen is sort of a bit of culture shift, particularly around policing in Canada and in understanding sort of the motivations of this. And I think the climate of prohibition and the laws of prohibition for 100 years have given really powerful tools to law enforcement that wants to use them. And so it's a form of controlling populations. It's a form of creating, responding to constituents that want public order and public safety, and you have a lot of stigma around people who are consuming all kinds of drugs. And so I think generally, when we unwrap the mindset of prohibition and start thinking about more equitable and justable approaches to substance use generally, then it leads us to maybe a more common and equitable position of law enforcement across Canada. Ideally.
Sure. Thanks. Maybe we'll take one last question at the back. Thanks there.
On that note, I just wanted to ask you if it's ever possible that Canada may go down the route that Portugal went, and that may help with the opioid crisis. where every drug is legally allowed to be consumed?
Yeah, so that, as a lawyer, just point out, so that's not quite the case. So, Portugal is often held up as this model of decriminalization. And so what they've done is they've created a level of thresholds for all drugs. Or most commonly used drugs. If you're below this threshold, you have to go in front of a advisory board called the Orwellian name of the Dissuasion Commission, and you talk to some folks in sweaters, and ultimately you're educated and dissuaded from using drugs. And if they determine that you have a problematic relationship with drugs, then you're sort of softly coerced into getting treatment and doing certain things. If you're over this threshold, it's criminalized. And so I think, Portugal is held up as both this utopia for decriminalization, but it's also this unachievable aim, where our government, when we say, like, why don't you think about decriminalizing in Canada? We're told, like, oh, well, we're not Portugal, which is sort of this conversation stopper. And so what I would suggest is looking at prohibition, we see and we can document the harms of prohibiting substances and the effect it has on both the people on the ground, which is very harmful, and also just on the availability of substances, which doesn't really do anything. You could arrest and arrest and arrest, and we will still have people out there consuming substances and people selling and producing substances. And so if we recognize that prohibition doesn't work, the response to that is just, let's not prohibit. Let's decriminalize, full stop. Let's take the money we save from reallocating law enforcement funds, and let's invest in education and treatment for everybody who wants to access it. We don't need like a giant bureaucracy to create, to run people through. Really what we just need to do is unwind and decriminalize. And so unfortunately, that's a conversation that the federal government is not yet willing to have, and so they've closed the door down on it. But we definitely need to think about it. It won't be enough to solve our overdose crisis because we have a crisis of supply in a toxic drug market, and so I think we actually need to think about what a legal model for regulating all drugs in Canada would look like based on principles of public health and based on principles of social justice and human rights. And when we can think about that and start looking at the rest of the drugs, then I think we have a chance to sort of address some of the issues behind the overdose crisis.
Thanks, Scott. So I'd like to draw the question and answer period to a close and wrap up the event here. So I'd like to thank everyone in the audience for being here this evening and participating and attending the event here tonight. Thank you very much. I'd like to say thanks to all of the speakers for your excellent, very informative presentations. We greatly appreciate it. I'd say thanks to everybody from Simon Fraser University and the Faculty of Health Sciences that helped to organize the event. So Clement, Rihanna, Christina, thank you very much. And sincere thanks to the Surrey Firefighters Charitable Society as well for supporting this lecture series focused on mental health and wellness. Thank you very much.